Welcome to the step-by-step guide on scanning for a single crown restoration using 3Shape Trios scanner. Firstly, meet and greet the patient and make him seated comfortably in the dental chair. Move the dental chair in the supine position. The 3Shape Trios scanner should be in front of you so that you can see scanner easily. And while you are scanning, you can avoid any discomfort and unnecessary strain in your neck. Move your chair to 12 o'clock position and switch off the chair light for avoiding any reflection during the scan. First, click on Create New Patient and then select New Case to begin. Next, select the lab with which you want to proceed with the case and click on New Scan. The order form will appear, allowing you to choose the tooth that needs restoration. Now suppose tooth number 3, which is upper first molar, requires a crown. Select the tooth number 3 for this case. Click on Anatomy option from your left and select Crown. From the Material drop-down list, choose the preferred material for the crown. For this case, choose Zirconia Monolithic option. Then move to the right of the screen and click on the Delivery Date button and set the delivery date. Now select the time as per your need. Start by drying the field with the suction. Make sure there should be no saliva pooling during the procedure. Now click on the Next button and move to the scan page. Hold the scanner in your hand with a palm or grasp. To start scanning, place a clean scanning tip to the scanner and ensure that the mirror side is facing down. First, let's start with scanning the mandibular arch. Follow the scanning strategy. In the green trigger, keep the wand flat to the occlusal surface and begin scanning the occlusal surface. Starting from the molar to the canine. Move steadily for accuracy. For scanning for a single crown, single quadrant scan is enough. From the canine, slowly roll the scanner 160 to 90 degree to the lingual side and follow the green trigger and move it in a distal direction till the last molar. Now from the lingual aspect of last molar, roll over and keep the wand horizontal to its buccal side and scan the buccal side by moving the scanning tip forward and follow the green trigger. Start by drying the field with the suction. Make sure there should be no saliva pooling during the procedure. Now, for scanning the maxillary arch, set the scanning tip in the upward direction. We have two options for this. First, let's learn to do option 1, that is removal of retraction cord and immediately scanning the area before the gingiva collapses. For scanning, first scan the tooth of interest by scanning it from occlusal aspect by keeping the wand flat, then slowly roll over to buccal by keeping the wand horizontal, and then scan palatal aspect at an angle of 60 to 90 degree and follow the green trigger. Then from the computer screen, select for locking the margin by clicking on the lock surface tool. Now paint the margin to lock the surface by moving the cursor over the margins of the scan preparation. This will lock the position of the gingival margin and the tooth, whereas other areas can be scanned. Now, complete the scan following the scanning strategy. Continue scanning the occlusal surfaces first from the molar to the anteriors, keeping the wand flat to the occlusal surface and follow the green trigger. Then from the anteriors, slowly roll to the buccal side, keeping the wand horizontal, follow the green trigger, and move the scanner in distal direction. Afterwards, slowly move to the palatal side by keeping the wand at an angle of 60 to 90 and scan, follow the green trigger. Now let's look at option 2. Option 2 is scan all the surfaces without removing the retraction cord. Following the scanning strategy, scan the occlusal, buccal, and palatal aspect following the green trigger. Now select the trim tool and trim away the margin surrounding the tooth. Just select the area you want to trim. Now, remove the retraction cord using a tweezer and dry the teeth and scan immediately. verify the scan by zooming in on the preparation. For verifying the scan, for any missed area, mark the tooth. Press the Mark Tool button on the left side. This button will let you know about any holes in the scan by a pop-up. Pressing on the amber arrows will rotate the scan and show the areas not scanned properly. If the areas are on essential points, such as margin line or tooth surface, rescan that area, otherwise, there is no need for rescan. Now after both the quadrant scans are completed, let's scan the bite of the patient. Position the scanning tip between the upper and lower second molar and ask the patient to close and move the scanning tip forward in a wave-like motion and follow the green trigger. Scan 3 to 4 teeth until the upper and lower arches snap together. After completing the patient bite scan, now click on Next to go to the patient-specific motion page. Start scanning on the blue marked areas following the arrow. When the areas turns green, ask the patient to start grinding the teeth. After you think you have recorded the movements, ask the patient to stop and stop the scan. You can play the recorded movements by clicking on the play button. Now you have recorded both the bite scan and the motion scan for the patient. By clicking Next, you can now go to the validation page to confirm that there is enough space between the upper and the lower teeth. Click on the clearance tool to show the clearance. Check if there is sufficient clearance between the prepared tooth and the opposing tooth. Now let's proceed to send the scan and share the scan with the lab and the patient. Click on Next to send the scan to the lab. This will open the Send page. On Send page you can see the summary of your case. Send to Patient option gives you the possibility to send scans to the patient. Press this button and enter the email address of the patient to share the case. Now, press Send to send case with the lab and the patient. Congratulations! This completes your training on Trio's scanning for single crown.